Our final segment on Morning Line today is we talk about healthcare. Kinika Young's with us from the Tennessee Justice Center. Also, Linda O'Neill. She's with us from the Tennessee Commission on Children and Youth, talking about how some of the proposed changes being discussed right now in the U.S. Senate could affect us here in Tennessee. Thanks both for coming on. This is great. I'm learning a lot. Let's go next to Jean. Jean, good morning.
Good morning.
Hi, Jean. What's on your mind?
Yes, I am presently listening to your program, and I just want to stick a pin and get some clarification as to my mom is in a nursing home, and part of that is Medicaid, her Social Security, and her retirement. Now, if they cut the Medicaid percentage that she qualifies for, I thought I heard her say that rolls back over into the family's income to provide for that. Is that true?
It certainly could. It
well, not necessarily. It's not that the government's going to go after. It's just the money's not there, and they're going to say, do you have any other means to pay? And if there's a family member that could help, that's how it would go, right?
It'll be the nursing homes that start to have to deal with families on how can we cover the cost, because if Medicaid payments go down, it does not mean that their cost of care will go down.
Right. So it's not like they would come after you for monies, but the nursing home will call and say, look, we need to have the money paid or we're going to kick your mom out.
Okay, that's what I thought I understood, and I was really taken to surprise when we really had to put mom in a healthcare facility that it sounded like you were on Medicaid, but we were fortunate enough to have our retirement and all of that that took place. All right then, and thank you so much.
Thank you for your call. So yeah, we know Medicare does not pay for nursing home care. You know, you get Medicare when you reach, retirement age, and a lot of people think it does not. Now, the folks, just so we're not confused, her elderly mother has her Social Security. Okay, they had some retirement. Now, how is it she qualify? Since when does Medicaid pay for a retired senior to live in a nursing home?
So Medicaid has always been one of the major payers for retired seniors in nursing homes because the cost of nursing home care is such.
But you have to qualify for it.
You do have to qualify from an income standpoint, but
Meaning
she can have Social Security and retirement and still be eligible for Medicaid to help pay for those costs.
And to be eligible, meaning that her Social Security and retirement are at a level.
Low level.
At a low level. And so that is how you would.
Right.
If you have means, you're not going to have Medicaid helping you at that point. But there are a lot of seniors in nursing homes or assisted living that are getting supplemented by Medicaid.
Absolutely.
Yeah, the whole thing's confusing, right?
It is confusing.
Let's go to Mike. Mike, good morning.
Good morning, Nick. How are you?
Good, Mike. What's on your mind?
Well, the thing about it, I know these ladies and you haven't got the answer to it, but with the government's always funding. And this, I'll give you a quick example. We're right now presently paying farmers in Afghanistan $100 million not to grow opiate and marijuana. Wow. Now, why does the government take that stand? Why don't they take a stand like if you raise a good crop, then we'll support you. If you raise a crop that we deem detrimental, we'll destroy it. And take that $100 million and put it back into programs like this one right here.
Sure. Listen, I mean, hey, man, I think we could go through the line, and that's a whole different show about where there is government waste and certain things, and what you just said there makes perfect sense to me. I don't know about the program. But, yeah, that's what it comes down to, is maybe where else you could take money, how it goes about. I don't know.
I'd like to mention on this idea of the federal government spending. What we have to remember is that these are our tax dollars. We can direct where that money goes through our votes. We elect politicians to carry out the policies that we think the federal government should prioritize. And so the way that you can get them to pay attention and to do the things that align with your sense of fairness and how you think your money should be spent is by voting.
That's exactly right. And what we are dealing with now is one of the big campaign promises from President Trump was that he was going to get rid of Obamacare and pass something that was going to be better. And that sounds great. And that's what people elected him on at this point. Now, if that's not delivered, okay, the people who voted for him are going to all of a sudden have things happen in their lives they're not so good. And
well, he also promised to bring down prescription drug costs, and this legislation will do nothing to address that. I think that in response to what Kinika said, she's absolutely right about voting, but we're a state that has some of the lowest turnout in the country. So we need to, all Tennesseans who are eligible to vote need to be registered and need to vote.
Absolutely. Get out and vote. All right, so as we wrap things up here this morning, what do either of you have a crystal ball where you can give me an idea of what you expect might happen? Or is that just too hard to even know? We know they've postponed it. Okay, we think they postponed it because if they vote now, it's not going to do it. And, and here's the thing, though. How much of this is political? What's happening right now? I mean, what do you think? And I know I don't want you guys to get political yourselves, but it's political right now. It's based on a campaign promise from a lot of these folks that were elected based on replacing. And you can make the argument that whether this is good or not, they have to pass it, because to not do so would be devastating for them because of the promise that was out there over and over. But do you go ahead and pass something that isn't very good just so you can deliver on a promise?
But what they haven't done is have an open process where they make a really concerted effort to bring together Republicans and Democrats, to bring together representative stakeholders in the healthcare industry, including patients, and really talk about what should our healthcare system be and how can we do that.
They just all can't agree. And that's the problem. They're never going to all agree.
They're never going to all agree, but if they don't have an open process that really gets information from the states, from the stakeholders of what the impact will be, then it's harder to do something that is productive. We could have a good healthcare system. We have a good healthcare system. We could have a good healthcare payment system in this country if people were really open to a give and take and not just focused on repeal Obamacare, but focused on what should the healthcare system in America be.
Yeah, just improving it. Just getting a new deal for the sake of getting a new plan isn't good if it's not better. That's my take.
Could I just add that the process is flawed here, and it's something that Linda just mentioned. They haven't had any public hearings. If the Senate is determined to pass something that's better than the Affordable Care Act to make good on that promise, why not hold hearings and have experts, healthcare providers, industry people come in and explain and clarify what would be better than the Affordable Care Act and what are the unintended consequences of the bill that they have on the floor now.
Yeah, find a way to improve things. But that's the very reason they haven't done that, is because that makes sense, and this is political. It's all political, folks. Rod, real quick, what's your comment?
Yeah, I think I got the cure.
Oh, wait, what's that?
Do it. Take all the lifetime health care insurance from all your congressmen and stuff. Lobbyists, and stop the lobbyists from walking in the door.
There you go. Yeah, well, yeah, they don't have to worry about their health care.
No, and it's interesting. I think I heard back when the House passed their version of their health care bill that they exempted themselves from the provisions. Yeah. So the plans that the representatives and senators are on are not subject to the new rules that they're passing for everyone else.
Does that not burn constituents? That's crazy. Listen, we'll continue to follow this. Kinika, thank you so much.
Thank you for
you're
having
terrific,
me.
And Linda, as always, both of you for coming on. We'll talk more about this, and if you don't mind coming on again sometime, maybe even after this passes, and we start seeing what happens. Is that all right?
Sure.
You guys come back on?
Hopefully that won't happen.
Yeah, right. We'll see how it goes. We'll see how it goes. Thank you both for coming on this morning.
Thank you.
Listen, we'll take a break. I'll be back with a programming note right after this.
If you spend any amount of time in the great outdoors, hunting or fishing, you need to watch Southern Woods and Waters on News Channel 5+. Join host Hugh McNaughton and our area's top sportsmen as they share their experience and knowledge. Southern Woods and Waters is all about Middle Tennessee, and it's live. Call in with your questions. Whatever the season, that's what they're talking about. Tune in to Southern Woods and Waters Thursday night at 8, or catch the encore presentation Sunday night at 8 on News Channel 5+.
Spacious skies, for amber waves of grain, for purple mountain majesty above.
All right, that is a wrap this morning with our guests. Appreciate all your phone calls. I will say this, we've got calls out, we've had calls out, and we will seek, hopefully by next week as well, if someone will come forward. We'd like to have someone come on and talk about the health care plan as it moves forward, who is very much in support of exactly what we see happening. And I think they're in support of change because they think it can always be made better. It's just that the plan and what we've heard to this point out of the Senate sounds like it's not necessarily better. It's certainly not an improvement, and it could be worse. But if we can get someone who will come on and really point out why they think this is a great thing too, we're going to invite them on as well. It's just the truth is, so far we've had a difficult time finding someone. If you know someone in one of these positions, you know, of a policymaker that will come on and talk about that, let us know, because we'll be glad to have them on. Listen, back tomorrow, same time, same place. Not tomorrow, it'll be on Monday. I'll be here before the 4th of July. Allison Fields, veterinarian extraordinaire, will be on. We'll take your calls. It's a good day for her to come on, the day before the 4th, because you know so many pets are freaked out by the fireworks and the loudness, and the animal shelters, unfortunately, the day after the 4th are full of dogs, and mainly dogs, that have run away or jumped a fence because they were outside and the fireworks terrified them. Keep that in mind if you have a pet, that you find ways to keep them insulated from all that. My beagle hates fireworks, and so we've got a thunder shirt. We put it on and we put the beagle into his cage and keep him someplace where he doesn't hear it almost all day on the 4th. Meanwhile, my pugs don't give a hoot. They like looking at the fireworks. So every dog's different, but think about that as you celebrate the 4th of July, and we'll talk about that, of course, with Allison Fields. In the meantime, stay tuned to the News Channel 5 network as always, and I will see you back here first thing on Monday morning. Have a great weekend. Bye-bye.